Now let's move on to the next topic, that is development of tongue, guys. It's a simple topic and it's an easy topic. So let us try to learn in a conceptual manner. Now first of all, let me tell you the orientation here. In the pharyngeal apparatus topic, I taught you about the pharyngeal arches. And pharyngeal arches, there are totally like 6 pharyngeal arches and 5th one will disappear. We have seen that entire story. So now there will be like 5 pharyngeal arches from here, the 5 pharyngeal arches from here in the middle. If you have learned the topic, you know very well all the pharyngeal arches are going to form this mandible, the maxilla and all this hyoid bone and all. Now in the middle of this, what do you have? You have your tongue. So this topic is actually continuation from there itself. So all the pharyngeal arches and their derivatives has been completed, and in the middle there should be formation of tongue there. So let us see right now how exactly the tongue will be formed. So let us use the same diagram again. For example, if this one here will be the first pharyngeal arch, the first pharyngeal arch here, and then the second, then the third, and then the 4th and 6th pharyngeal arch. And black color I am using for ectoderm and the same red color I am using for the endoderm. I am following the same color code from the very beginning of this topic. Similarly, on the other side also, let's just complete this diagram here. The first pharyngeal arch and then the second pharyngeal arch, the third and the 4th and 6th pharyngeal arch. Ectoderm with the black color there, and then endoderm we have been using red color for that. Perfect. And now suppose this one here will be the midline. This will be the first pharyngeal arch, the second here, the third here, the 4th and 6th one here. So I hope now you people are expert right now. It's like our own pharyngeal arches. The first, second, the third and the 4th and the 6th arch. Now one thing, if you people are properly following all my videos in the sequence, one thing I would like to help you with that. I don't know whether you have appreciated that in this diagram or not. Normally arches are covered on the outer side by ectoderm and on the inner side by endoderm. But if you look at the first arch, how I have drawn here, the first arch is having ectoderm on both the sides. Ectoderm on the inside as well as the outside. Please take a note of that one. So remember, that's an exception over there. The first arch is the one which is covered by ectoderm on either side, and I will tell you the importance of that within some time. Don't worry. Now in the development of tongue, what are the things which are required here? My dear friends, in the development of the tongue, first of all, what is going to happen here is that there will be 2 thickenings here, and these 2 thickenings or these 2 swellings here are known as the lingual swellings. And there is a reason why I am drawing that in yellow color. Why? Because, yes, the next important thing that we have to understand here is that thickening of whatever lingual swelling I told you, that lingual swelling is that formed from ectoderm, endoderm or the mesoderm. That means that lingual swellings are the ectodermal swellings or endodermal swellings or the mesodermal. Remember, these lingual swellings are actually mesodermal. Don't think that sir is drawing the diagram on the inner side, we are looking at the pharyngeal arches from inside. So they are endodermal thickenings. No. They are actually the mesodermal thickenings. Mesoderm is actually going to form the thickenings known as lingual swellings. So L stands for lingual swellings. In between these lingual swellings, there will be one more swelling here that is known as tuberculum impar. There will be one more thing that is known as the tuberculum impar. So TI stands for tuberculum impar. But I'll tell you one thing here, tuberculum impar doesn't have any much role in the formation of tongue, in the development of tongue. The reason, it is actually present over there, it is a swelling over there. But when the complete tongue is being formed, okay, completely derived, then what will happen? The lingual swellings will actually overgrow and overgrow in such a manner that the tuberculum impar will be completely engulfed inside. So, you'll not be able to appreciate that separately in the final outcome. So, it's only the lingual swellings, and lingual swellings will go overgrow in such a way that tuberculum impar will be like completely engulfed inside that one. And where do you find this tuberculum impar in the lingual swellings? whatever hard work we have done for this reason only. These swellings are actually mesodermal swellings, and that mesodermal swellings are present from which arch? They are formed from which arch only? The first arch. So that's what I'm telling you, all that hard work that we have done to draw the diagram to make you understand that these swellings are present in the first arch, the mesodermal swellings of first arch. Then after that, yes, there will be one more swelling present over here in the third arch and the fourth arch. In the third arch and the fourth arch, again that is also the same thing, sir. There is also a mesodermal swelling, and this one is referred to as hypobranchial eminence. So I'm just writing here, guys, that is hypobranchial eminence. And again the same thing, even that hypobranchial eminence is also a mesodermal swelling in the third and fourth arch. In the third and fourth arch. And later on, my dear friends, remember the hypobranchial eminence, we can again divide them into two categories or two parts there. The upper part, that is your cranial part here. Let me use totally a different color here. So this will be the cranial part, and this here will be the caudal part of the hypobranchial eminence. The cranial part and the caudal part of the hypobranchial eminence. So I'm telling you a little bit slowly here so that you first of all learn this terminology. So what is required for the formation of the tongue here? The lingual swellings and the tuberculum impar in the middle, and then the hypobranchial eminence divided into cranial part and the caudal part. And now the only thing that we have to do here is learn which part from all this, that is lingual swelling, tuberculum impar and hypobranchial eminence, which part is going to form anterior 2/3 of the tongue, which part will contribute for the formation of posterior 1/3 of the tongue, and behind the tongue you actually have got the epiglottis wala part. So let us see which is going to form which part of the tongue. So if I now just draw the diagram of the tongue, we all know very well, conventionally we'll be dividing the tongue into anterior 2/3, and then there will be posterior 1/3 of the tongue. And in the anterior 2/3 of the tongue, you will also have those circumvallate papillae. So these are nothing but the circumvallate papillae. Now, welcome to the climax of the story now. Now let us see which part is going to form which part of the tongue. So first of all, remember my dear friends, lingual swellings. The two lingual swellings, they are the one which are overgrowing, and together they are going to form the anterior 2/3 of the tongue. So anterior 2/3 of the tongue will be formed by lingual swellings. Make sense? Whereas tuberculum impar, as I told you, it will not be visible over here. It will be completely overlapped by the lingual swellings growth. Then what about the posterior 1/3? The posterior 1/3 along with the circumvallate papillae, the posterior 1/3 of the tongue along with the circumvallate papillae, all this will be derived from the cranial part, the cranial part of hypobranchial eminence. Cranial part of hypobranchial eminence. And guys, if you are observing very carefully, it completely makes sense. It completely makes sense. Why? Because cranial part of the hypobranchial eminence, if you are observing there, it is actually a part of your which arch only? Third arch. This here, it is a part of your third arch. And just now I taught you the third arch is the one which will be supplied by glossopharyngeal nerve. First, second, third, fourth and sixth arch, 5, 7, 9, 10. So third arch is supplied by ninth nerve. And I hope you remember from the gross anatomy of the tongue, I told you posterior 1/3, it is a ninth nerve. 5, 7, 9, 9, 10, 10. We have learned that nerve supply of the tongue in the gross anatomy itself. And then what do you have like behind the tongue? Anterior 2/3, posterior 1/3, behind the tongue. Just behind the tongue, what do you have there? You will be having your epiglottis. And epiglottis is the one which is actually derived from the caudal part. Epiglottis is actually derived from the caudal part of hypobranchial eminence. Caudal part of hypobranchial eminence. Perfect. So all those structures that you are able to see in the middle there, all of them are derived from, yes, particular part. So lingual swellings are going to form anterior 2/3. Cranial part of the hypobranchial eminence, that is going to form the circumvallate papillae and the posterior 1/3. And the epiglottis is the one which is derived from the caudal part of hypobranchial eminence. Perfectly done. Now, once you are done with the derivatives of the tongue, how is the tongue forming? Next, two more important points here. Number one, what about the muscles of tongue? And muscles of tongue, we all know very well, they are derived from the somites, and that too occipital somites. Occipital somites are the one which are going to form muscles of tongue. And I'll tell you like how to recall this one, how to remember this one. When we studied about the pharyngeal arch topic, pharyngeal arches, when we studied in our previous video, in our previous topic, pharyngeal arches, I told you pharyngeal arches are the one which are going to form muscles of mastication, the muscles of facial expression, pharynx, larynx, palate. So all these muscles are derived from pharyngeal arches only. But except two group of muscles which are remaining, we are remaining with the extraocular muscles and the tongue muscles. And you people are going to remember from now onwards in the same manner. So almost all the muscles in the head and neck are derived from the pharyngeal arches only, except the two group of muscles, extraocular muscles and tongue muscles, and they are the one which are derived from the occipital somites. They are somatic muscles, somites. Okay. So all the muscles of tongue are derived from the occipital somites, occipital somites. And here I can actually include one exception here, guys, that is except palatoglossus. And why it is an exception here, sir? Except the palatoglossus, from the name itself we can understand. From the name itself we can understand that it is palate, palatoglossus, it is a muscle of palate also. And that is not exactly derived from the somites, it is actually derived from the pharyngeal arches. Easy to remember. Last and final thing is about the epithelium. About the epithelium which is covering the tongue. Epithelium of the tongue is derived from where? Ectoderm, endoderm or the mesoderm. Now the covering epithelium of the tongue in the anterior 2/3 will be only and only derived from ectoderm, whereas the posterior 1/3, the epithelium covering will be derived from endoderm. So how can you tell so confidently here? That's the reason why I told you in the very beginning of this topic here that first arch is actually covered on either side, on the outside as well as inside, by ectoderm. That is the reason why from the first arch itself what is going to form? An anterior 2/3 of the tongue is covered by ectoderm. So therefore lining epithelium from ectoderm. And remaining part of the tongue, that is posterior 1/3 and everything, is covered by endoderm. So therefore lining epithelium is derived from endoderm. So that makes sense there. So the epithelium covering the anterior 2/3 of the tongue is derived from the ectoderm, whereas the epithelium covering the posterior 1/3 of the tongue will be derived from endoderm. And by this we complete each and every aspect related to the tongue here, development of tongue. Now I want to include like one more thing over here. Just near this tuberculum impar, we actually have one opening, one foramen. So that foramen is nothing but foramen cecum. We actually have one opening there, that is nothing but the foramen cecum, that is endodermal foramen there, foramen cecum. Now what is the importance of this? That from that foramen cecum, it's actually going to invaginate and it is going to form a duct, and that duct is actually referred to as thyroglossal duct. And thyroglossal duct is the one which is actually helping us in the formation of thyroid gland. So let us see about the development of the thyroid gland here. So followed by this development of tongue, if we learn the development of thyroid gland also, it makes sense. So imagine this one here to be the arch number 1 and arch number 2. I'm not going to draw the entire thing again. And similarly on the other side also we'll be having the arch number 1 and then the arch number 2. And somewhere here the midline, the first arch, and then the second arch over here. In the first arch you have got the lingual swellings here, and then there will be tuberculum impar in the middle, and then there will be a foramen there. That foramen is nothing but the foramen cecum. Foramen cecum. Now from that foramen cecum there is a duct which is going to move downward. Actually in this diagram I'm telling you damn sure you will not get like complete orientation, but you have to practically imagine. For example, the tongue here, the anterior 2/3 and the posterior 1/3. And between the anterior 2/3 and the posterior 1/3 there is a foramen cecum, and from there invagination and there is a duct which is moving down. So your tongue here and the duct is actually going to move down. That is your thyroglossal duct. And the tip of the duct is going to bifid, and that is the one which is actually going to form your thyroid gland over here. So the important thing to remember, the name of this duct is Thyroglossal duct. And finally, it is going to bifid here to form your gland, that is your thyroid gland here. And that is the reason why it makes sense, because that thyroglossal duct is going to invaginate and go down and form the thyroid gland over here. That is the reason why you will be able to find the ectopic thyroid gland tissues at various places over here. About that in the surgery part. So in anatomy part, the normal development of the thyroid gland has been completed here. Foramen cecum, the thyroglossal duct, and that the tip of that is going to bifid to form your thyroid gland over there, guys. Okay, so that completes the entire thing regarding development of tongue as well as the development of thyroid gland here. Thank you.